Okay, everyone's favorite, but not yet. I have the pleasure of the closing remarks this afternoon, so if you could please bear with me. And then we will have our raffle, and then we will return to the historic courtyard with the DJ for those who, yeah. Okay, so today was a great day, right? Everybody give themselves a hand. So again, my name is Yasmin Tarver, and I'm the Director of Workforce Development at the Jenesse Center. And I wanted to just close with a little bit of context about the day and the month. So October was declared National Domestic Violence Awareness Month in 1989. And since then, October has been a time to acknowledge domestic violence survivors and be a voice for its victims. Domestic violence is prevalent in every community, affecting everyone regardless of age, socioeconomic status, sexual orientation, gender, race, religion, or nationality. Those in this work know the devastating consequences of domestic violence can cross generations and last a lifetime. And yes, a lot of people know this, but you'd be surprised how many times I walk into a room and people don't know the words that I just said. They don't know that it can affect so many people. So please bear with me for repeating it again. A 2013 Forbes magazine article titled "Domestic Violence, a Secret Killer That Costs $8.3 billion Annually" said that the U.S. has 24% of adult women and 14% of adult men have been physically assaulted by a partner at some point in their lives. It is the most common injury for women ages 18 to 44, and it leads to an increased incidence of chronic disease. Abused women are 70% more likely to have heart disease, 80% more likely to experience a stroke, and 60% more likely to develop asthma. Nearly a quarter of employed women report that domestic violence has affected their work performance at some point in their lives. Each year, an estimated 8 million days of paid work is lost in the United States because of domestic violence. Domestic violence costs roughly $8.3 billion in expenses annually, a combination of higher medical costs, which was around $5.8 billion, according to the Forbes article, and lost productivity at $2.5 billion. So let me tell you a little bit about Linda. We often hear stories like Linda, who left in the middle of the night because she knew that's what she had to do again. Her husband was very intoxicated this time, having attended a holiday party, now snoring heavily and would not wake easily. She gathered her children swiftly, her 2-year-old son, 18-month-old daughter, grabbed the bag she had packed earlier, and quietly shut the apartment door. Years of abuse had led her to this, but what was her next step? It was to leave and try to escape the violence, but where would she go? That uncertainty concerned her, but she was scared, and she knew she had to try and leave once and for all, even if it meant she and the kids would become almost instantly homeless. Staying at a girlfriend's place was not an option because as soon as her husband woke up, he would be in a rage and find her there. So she took the car and thought driving far away as possible. She drove. The children started to shake and move and wonder where they were going, and she sang them back to sleep. And as she drove, she said, "Mama's got you." Terrified but determined, she looked for a safe place to park to sleep in the car that night. She would figure out her next step in the morning after some rest. All types of abuse, including what Linda and her children experienced, are horrible. Linda had tried multiple times to escape the situation to a safer place. Becoming homeless was an unintended consequence, and yet another challenge Linda and her children now had to face. The next day, Linda decided to drive even further, several counties away, to a new city where she and the children can settle for a while. And then she felt it. It was overwhelming, living in her car, needing to start over, full of so many questions. What about income? What about housing? What about quality childcare so that my kids are safe while I look for housing and employment? Luckily, one day, while her phone was still on, she was able to contact a friend, and a friend assisted her with a hotline number. And over time, the agency she contacted assisted her with applying for cash assistance, childcare, and housing. That was Linda's story. We heard countless stories like this every day. Although there has been progress in reducing domestic violence, stories like Linda's are still being told too often. An average of 20 people are physically abused by intimate partners every minute. This equates to more than 10 million abuse victims annually. 1 in 3 women and 1 in 4 men have been physically abused by an intimate partner. Millions of Americans live daily in silent fear within their own homes. Domestic violence incidents affect children's emotional well-being and social and academic functioning, as why today one of the focus areas on the symposium was for the youth. There's been progress in the domestic violence movement. We've had increased awareness, legal reforms. Many states have enacted stronger domestic violence laws, support services, the growing availability of support services for victims, training and education for professionals in various fields, community involvement, research and data, ongoing data collection to understand domestic violence dynamics and its root causes. There's been a cultural shift. Society is gradually shifting its attitudes towards domestic violence with a growing understanding that it's unacceptable. And technology and safety. Technology has improved measures for victims, including developing apps and resources to help individuals in dangerous situations. And then there are still challenges. There's underreporting. Many victims still hesitate to report domestic violence. There are shortages in research and resources, There are still cultural and societal norms that perpetuate domestic violence and make it challenging for victims to escape or seek help. There's a complexity of a case. Domestic violence cases can be complex, involving multiple issues such as child custody, housing, financial issues, immigration, and others, making it challenging to address everything simultaneously. The legal hurdles. The legal system can be intimidating and sometimes inadequate in protecting victims and supporting them through legal services. Providers have gotten more support over the years to do so. And then lastly, the intersectionality. Different groups may experience domestic violence differently due to factors like race, ethnicity, gender, some of that was talked about today. But addressing all of this requires a multifaceted approach involving all of us in this room and everything that we learned and taking it back to our homes and our communities, to the people that we serve. So today, as we reflect on the progress that is made, the lessons that we learned, and the challenges in the fight against DV, I urge you to be a part of the solution by supporting local DV organizations with their needs, advocating for trauma-informed care within our healthcare community, advocating for policy changes and raising awareness in your own communities. Over the years, the Domestic Violence Council has used our collective expertise and resources to promote DV awareness and provide training to healthcare providers throughout Los Angeles County to improve a trauma-informed response to DV victims and survivors. Remember, change begins with each of us. You can contribute to a safer, respectful, and more equitable society by taking action. We can make a difference and work towards a world free of domestic violence. Thank you. So now I would like to thank our sponsors. First, I would like to thank the Blue Shield Foundation. For their continued support of the Leadership Council and the symposium, for being a thought partner and a great listener through the conversations that we have, and allowing the Leadership Council the freedom and flexibility with their funding to be the experts in serving our communities. I would also like to thank the National Health Resource on DV, a project of Futures Without Violence. I would like to thank all of our speakers and all of our panelists today. Thank you so much. Especially want to thank our survivors, all right? That's bravery in its finest, telling your story. To the symposium committee, we start this in March every year to put this on. Can we please have them stand? And we want to thank Jennifer. Jennifer is our glue that holds us all together. I would like to thank the Los Angeles Department of Public Health, Office of Women's Health and Domestic Violence Council. The staff from all of our collective agencies who have been here, some of them since 7 o'clock this morning, and just doing whatever's asked. I just totally appreciate you guys. To all of our vendors, exhibitors, and all of your support for the Beyond Silos Symposium. I want you to please remember to visit the conference table in the foyer. Please fill out your evaluation so you could get a gift. Just repeating that all of the slides and recordings will be available in about 2 weeks on our website, and we will notify you by email when they're available. We are going to go back into that glorious courtyard with music and a reception. So please join us for hors d'oeuvres and drinks out there. And I wanted to, one more thing before we do the raffle. I want to give a special thanks to Jennifer from me. Jennifer was pregnant during this process. She had a baby. She went on maternity leave. And one night technically it's morning, at 1 o'clock in the morning, she was back. And from there, we've been working feverishly to make this happen during these last months. Jennifer is a great person to work with, and I really, truly appreciate her and her dedication to the symposium and to the Leadership Council. Come on, Jennifer. Okay, I'm not good, and my boss, Karen Earl, is going to start. Don't make me cry, because I'm a crier. Thank you, Laura.
I just want to say thank you so much. This is our 4th time doing this, and it's a really beautiful conference, and I'm really proud to be a part of it. And for as hard as I'm working on this, so is Yasmin. So these are just as much hers as they are mine.
Thank you.
Yes, thank you.
Okay, now what you guys were really waiting for, the raffle.
What's the setup for the circuit? Then you'll get people to fill it out.
Okay, who would like to be? Okay, Virginia. Uh-oh. She dropped all her stuff, y'all. She's excited. Okay, we have a lot.
Shake it though. Shake it like a Polaroid picture.
Oh, wow. Oh. Uh-oh. Yeah, I can't. Okay. 148231. One 48249. Nobody? They're gone? You have to be here to win. 148256.
Good sign.
Okay. 148337. 337.
Hanging Chad.
148254. All right. One 48229. 148261. Going once, going twice.
Keep it moving.
148240. Okay.
Wait, hold on. 261.
6-1 and 4. Okay, good.
That's it. That's game.
Come on. What are your last three numbers? Okay. And 240.
Oh, 240.
Oh, yeah, we still got a few more.
Okay, great.
148274. All right. She sounds like Price is right there. Here you go. I know. 148262. Okay. Give me some more. 148286. Okay. When I call these winners, your prize is the table centerpiece. Okay. Now, just so we're aware, so we don't have what happened in the self-care room, we're going to give the centerpieces to the workers and to the survivors, and we're raffling away some of them as well. Okay. All right. Just been.
It's the
148209. All right, that's yours, the flowers. Okay. 148212. Okay. 148267. Okay. And the last one is 148318. All right, okay. Again, we would like to thank you all for attending today. Please turn in your, show proof of your evaluation and join us in the courtyard. Thank you so much.
Very good. Hallelujah. Let's go do the hustle.
We want to thank our sponsors, the Blue Shield of California Foundation and the National Health Resource Center on Domestic Violence.